share my screen now?
Well, just start telling us who you are, where
Oh,
you are.
just okay, introduce for, oh, now I gotta get rid of that somehow. Okay. So I'm Maggie Highland. I'm at the University of Wisconsin, but within the Wisconsin Veterinary Diagnostic Laboratory. It's a separate entity from our veterinary school, which is a little bit different than many veterinary schools that have their state diagnostic lab kind of embedded within the veterinary school. We have our own facility here and our own set of pathologists. So I am a pathologist by training. So I'm a Wisconsin alum for my DVM, and then my residency was at UC Davis, and then I did a 2 additional years with the Milwaukee County Zoo with captive and wild species to get a little more training with wildlife species. And then I moved to the university. I moved to Pullman, Washington, where I received a PhD through the USDA training program at Washington State University in immunology and infectious disease in small ruminants. And then after that, I stayed as a veterinary medical officer with the USDA doing research, primarily on interface issues between wild sheep and domestic sheep. So respiratory disease was a big part of the work that I did. Um, and then I went to Kansas State Veterinary Diagnostic Laboratory for just shy of 3 years. And then a position opened here at the Wisconsin Veterinary Diagnostic Laboratory, and it brought me back home. So I've been kind of back and forth across the country and around a bit, and finally made my way back home here to Wisconsin, where I currently serve as the section head of pathology sciences and professional veterinary services at the diagnostic laboratory. My main passion is small ruminants, so sheep and goats. From a disease standpoint and as personal favorites, goats are probably one of my favorite species. So, and the picture that you're looking at there, that's my boy Skit. One of the best pictures I think I've ever taken with my cell phone. So, with that, I'll get started. And again, I'm a pathologist, so a lot of what I'm going to cover is more from a pathologist perspective rather than a clinical perspective. So if I may be able to help with a few clinical questions, but I am more, my expertise more lies in understanding disease and how do we diagnose disease to get answers to our clients. And here at the WVDL, we consider our clients to be uh, the veterinarian. We interact through the veterinarian to provide information to producers. We don't take direct submissions, at least not for very many things that don't come through a veterinarian. So we have some exceptions to that being chickens, backyard chickens, because it's even harder to find a backyard chicken veterinarian, I think it is, than to find a small ruminant veterinarian, if that's believable. Um, so
Dr.
we
Highland,
certainly could use more. Yes. Uh-huh.
have you started sharing your screen yet?
I did it not go
It's
through?
not shared yet.
Maybe it didn't actually.
Sorry.
Oh, my apologies. There we go. Did
Said something about those were your boys, and I think
Oh,
everybody
there,
was
did
like,
that come through now?
yeah, there you go.
Yep. I didn't hit the final button. Sorry. Technical
Yeah, everybody says
challenges
they
with
want to see
me.
the goat.
Yeah. You want to see the goat? So that's him. Smartest creature I think I've ever met. Okay. Let's see. Um, oh, there we go. So to start, this is more of a reference, and since this is being recorded, certainly people could use this as a reference. I think a table that lists some of the infectious agents that I'm going to, in brief, cover for each of these through this talk, but just sort of to provide an outline of some of the agents that we're going to be talking about. And then, so these are infectious agents. And then there are non-infectious causes of abortion also, or toxic type causes. Depending on where you live in the country, local weed and broomweed are two plants that can cause abortion. Nitrates can be found from plants that are good at accumulating nitrates. However, for sheep and goats, this really isn't a common toxin. They seem to be a little more resistant. When I was in Kansas, I certainly saw a fair share of nitrate associated abortions in beef cattle. So not super common in sheep and goats, to the best of my understanding. And then a dewormer that we may use in small ruminants. Need to be careful on the timing of using that. It's levamisole, which can be associated with abortions when it's given in late gestation. In addition, there are deficiencies and perhaps excesses that can also result in abortion, stillbirth, or weak kids being born. And I just have a list of those vitamins and some of the common trace minerals that can be associated with reproductive issues. And I'll mention specifically at the bottom, iodine's an interesting one in that, so iodine can cause goiter if it's both in excess or deficiency in the dam, so in the ewe or the doe during pregnancy. And I don't have a good picture of it, and I've had a few cases of this. You'll see a very large at birth. Whether the animal's born stillborn or they'll often these animals are born alive, take a few breaths, and they just can't thrive. They don't ever take off, and they'll die shortly after birth. You'll see two very, very large, or it's like a bilateral swelling kind of right at the corner of the jaw where it meets the neck or down along the neck. And if you open, you're going to see two large red structures, and those are the thyroid glands. We sometimes need to remind, we don't see it that often. So even reminding a DVM what that large swelling is, and it's pretty pathognomonic when you see that and the animal has failed to thrive. So we don't get a lot of them submitted because it can be a gross diagnosis, but you're not sure if you have to look at excess or deficiency in the dam to figure out what caused goiter and that failure to thrive or stillbirth. So with that comes the first question. So congenital goiter, congenital just means that the animal is born with the malady or the malformation. So congenital goiter or abnormal enlargement of the thyroid gland identified in a lamb or kid at birth. This can cause abortion, stillbirth, or weak lamb's kids that may die shortly after birth. So congenital goiter is caused by which of the following? And I think you can see the questions listed there.
The people start answering. I think already we have more of we have like a 65% of the people have answered already. Yeah, and they're very enthusiastic answering. Yeah. I will be ending soon.
Just a quick
Oh.
comment for anyone that is interested in the raffle, like being put into the raffle, or in the certificate that will come with completing this series of webinars. Please make sure that you either change your name in Zoom or type your name into the chat and send that through first and last name so that we can make sure that we tally your attendance.
Okay, I am ending the poll and I will share the results. So for Dr. Highland to give some feedback.
So the correct answer, and it looks like the majority had gotten that this can be caused, goiter, congenital goiter can be caused by iodine excess or deficiency. So the thyroid gland, in order to make thyroid hormone, iodine is a really important component of that. And I asked this question because I find it interesting that too much or too little both can cause a very, very similar lesion in that lamb or kid.
Okay.
Okay, so we'll begin with I'm gonna move this down. So we'll begin with the infectious agents that I'll cover in a little more detail than I do the toxin or micronutrients. So Toxoplasma gondii, cats are the definitive host, and many mammalian species can serve as intermediate hosts. So meaning that they can be kind of accidental hosts of this, and that includes humans. So that makes it a zoonotic disease agent. Zoonotic simply means that an infectious agent that typically impacts non-human animals can also infect humans. So those are considered zoonotic agents. Um, and this organism is really the reason that it's recommended that pregnant women not clean the litter box. You hear that often, and I know I had even as a kid and never really knew why, but that's this agent is probably the primary reason for that. So cats are thought to shed this organism only once in their life. And often humans that have been exposed to it will have antibody titers, so some protection for it too. So, not giving any medical advice on a human scale here, but having titer checks and knowing your cat's status of whether or not they have what their titers look like, what their antibodies look like, can you give you some indication of how much concern you should have to this being a risk for somebody who is pregnant in the household. Um,
Sorry, Dr. Highland.
oh yes,
Uh,
go ahead.
we had a question just back a little bit on goiter. I didn't
Yeah,
want you to get too far into toxoplasma.
yeah.
Um, if you had a kid born with goiter, if you have a kid born with goiter and have other does waiting the kid, is there any way to mitigate the risk to the kid's not yet born?
I would consult with your veterinarian, but you can do iodine supplementation, but you have to be really careful with it. Just and also there are some goiterogenic plants like brassicas. You may also want to look at your forage also in your pasture for that. And I didn't mention that in the poster, so it might not just be so some of that excess um, iodine. It could be iodine-like compounds that are considered goiterogenic compounds in different plants. Brassica family members are the one that come to my mind.
Okay, thank you.
So back to toxoplasma, transmission is typically through an oral route. So the dam may ingest this if you have a feline or barn cats that are defecating where they should not be. It can contaminate feed. So it's typically not an outbreak or like an abortion storm with toxoplasma. It's typically kind of a sporadic abortion here or there that you'll diagnose. Um, tissues can also be a source of this. So say you have rodents, maybe using poison, or for some reason a rodent gets into feed and is degrading, and that can contaminate feed also. Um, hosts can that carry this, so they can carry it in their tissue. So sheep and goats can potentially get cysts in cysted form in their muscle, and when they're pregnant, it's also described like this in cattle for the next protozoan agent also that we're going to talk about. But if they rupture those cysts and they go systemic with those and it crosses the placenta, that would be another way. But it can also be shed in milk from after birth. So it can be a source for humans consuming milk. There's been reports of infection when consuming unpasteurized goat milk. So transplacental transmission means that the protozoan has gone systemic, flowing in the blood, gets to the placenta, transfers into that placenta, where that's where it really does a lot of its damage is in the placenta. So breaks that blood blood barrier between the mom and the developing fetus. And it can damage the placenta and cause death of the fetus and thus abortion. And these abortions usually occur during the third trimester, or you'll have stillbirth. So right at the time, so maybe death, and then a little time goes by, and the fetus is born dead, or the lamb or kid is born dead. Um, this is one of the agents where it's really important to submit the placenta for a diagnostic workup. And oh, there we go. And then another protozoan agent that I'll mention, and I actually just added this one because we do test for it here, and it's not very common. It's not very common. Probably Toxoplasma would be more common than Neospora in my experience from doing workups on sheep and goat abortions. But for Neospora caninum, as the name would suggest, both domestic and wild dogs, are the definitive host. And similar to Toxoplasma, there's many species that can be intermediate hosts, including humans. So this is also a zoonotic agent. Very similar to Toxoplasma, oral transmission is the typical route of infection. Um, and often shed in feces containing oocysts that become infective after they've been in the correct environment. So once they're out into the environment, given the right humidity or moisture level, they can sporulate, and that becomes the infectious dose that can then be ingested accidentally by a sheep or a goat. And also similar to Toxoplasma, this organism can also be shed in milk and similarly be a potential for a zoonotic infection in humans that are drinking unpasteurized goat milk. Uh, Transplacental transmission. Once this protozoan, the infectious form, is circulating in the blood of the host, it can make its way to the uterus, cross that placenta, where it can infect the fetus. Rather than just staying in the placenta, though, unlike Toxoplasma, which pretty much hits that placenta really hard, this organism moves into the fetus where it really likes to hone in on muscle and the nervous system. So two tissues that we look. So I said skeletal muscle. Well, I said muscle, but that includes heart and skeletal muscle, but also nervous tissue such as the brain. So it'll localize to the brain. So those are the tissues that we try to look at when we try to identify this organism as being a cause of abortion. And again, like Toxoplasma, most typically it's associated with that third trimester or near term abortion or stillbirth. So the next agent, most people would still refer to this as chlamydia, and it used to be Chlamydia pecorum, but they changed the species name. I think microbiologists like to change the name of microbes all the time, so we have to keep up on that. But Chlamydophila is the current correct name for this organism, and it's Chlamydophila abortus. Sources of this bacterium can be semen from infected bucks or rams. And um, and another source, once it's introduced to a herd, can be in the placenta, fetus, amniotic fluid, uterine secretions. So reproductive tract is where this bacterium likes to live in the host and cause its problems. So infection. So transmission can occur from inhalation. So bacteria can be aerosolized from these sources, particularly during lambing or kidding. And then and it can be or ingested, so potentially contaminated feeds or just ingestion from the environment following birth or following abortion from this. And the venereal route is really how this can get introduced. So typically, I think think of this as one of the two agents where you bring a new ram or a new buck in to a naive population that has never seen this before. And then breeding season goes well, and then all of a sudden you start to see late term abortions. So once this bacteria crosses the placenta, again, it typically causes abortion in that last 2 to 3 weeks of gestation, or it'll cause stillbirths or weak neonates. This agent is associated with abortion storms. So again, a naive population of sheep or goats, your ewes and does, have a new buck or a ram come in, introduce that during mating season, during breeding season, and you can really see the effects, which this is really detrimental to producers, and that you really don't know this is going to happen until you've lost your lamb or kid crop for the year for large producers. It can be quite devastating. It's more commonly referred to as an enzootic abortion of sheep or an enzootic abortion of goats. Um, in the adults, you may, or in young that survive this, that are born, you may see concurrent pneumonia or arthritis, so swelling of multiple joints. It can also cause conjunctivitis in the adults, so it may give you a bit of a clue that something's going on after you introduce that new buck or ram, that if some of your does are coming down with pink eye, you may want to look into what's causing that. Um, and it can also, when it causes abortion, it often is associated with the placenta not cleaning. So the animal doesn't clean appropriately. So the placenta is retained within the dam. This organism also is zoonotic, so can cause infection in humans. A common presentation, I believe, is pneumonia when humans contract this Chlamydophilus species. And then this is another one where it's important for the placenta to be submitted for diagnostic workup. So it's one of the important organs that we look at, or tissues that we look at to make a diagnosis. The next agent, Campylobacter. So there's two, and I have Campylobacter jejuni highlighted here, and I'll go in more detail why that one's highlighted here shortly. But similar to the Chlamydophila, this is often also introduced by new carrier animals. And the carrier animal, rather than carrying it in semen or in the reproductive tract, they can carry it in their intestinal tract. Both of these Campylobacter agents can be carried in the intestinal tract. So infection among your herd, once you've introduced that animal, is typically the fecal oral. So it's shed in feces, accidental ingestion of the fecal contamination on the ground or on pasture. And then it's then transferred to a naive host. If that naive host is the dam who is pregnant, they can go this bacteria can go systemic, so it means circulated in the blood, makes its way to the uterus, and again goes transplacentally to the fetus, where it can cause stillbirth, weak lambs, or abortion in the last 2 to 3 weeks. You really can't tell the difference between an abortion from this. You can see a lot of parallel between Campylobacter and the Chlamydophila agent that I just talked about. This also, very similar, also causes abortion storms. The common term for abortion storms caused by this agent is vibriosis. It too can often lead to very high losses, 60% plus. I knew a rancher out west, a large ranch, sheep ranch, about 3,600 ewes. They lost about 75% of their lamb crop at that last 2 weeks. And it was by the time we got the fetus in, when I was in Washington, it was several more days before we had a diagnosis, and the abortions just kept happening. So they had started an antibiotic, but what wasn't known, and is not well known, even though it's been out there in the literature since as early as 2002, is that the majority of the Campylobacter that causes the vibriosis in the United States is now Campylobacter jejuni. It has pretty much taken over. We really don't diagnose Campylobacter fetus anymore, especially small ruminants, cattle too, for vibriosis. And what's really, really important, and I think for producers, to say, if you're having an abortion storm, to say to your veterinarian, have you heard about Campylobacter jejuni and the tetracycline resistance that goes along with it? Because most, if not every Campylobacter jejuni that's associated with vibriosis or these abortion storms is tetracycline resistant. And often tetracyclines were the first go-to when an abortion storm would start to occur. So stay away from tetracyclines. I can't give advice on what antibiotic to use, but I would certainly discuss with your veterinarians and your extension specialists. Oops. There we go. So Coxiella burnetii, most people refer to this as Q fever. Q fever is the disease that is caused that this bacteria causes in humans. I have an entire talk just on this bacterium alone. Um, so in animals, it's called cocciolosis, the disease is, but Q fever is probably what most people just in general use for the term to describe Coxiella burnetii, which is the name of the bacteria. The source of this bacterium is infected hosts or carriers, and carriers can carry it in their intestine and shed it in their feces. It can colonize the urinary tract, and reproductive tract, so it can be shed in urine or vaginal secretions. This organism also likes to live in lymph nodes, particularly around the udder, and when it's shed, it can also be shed into the milk. So it can also be shed in milk and in semen of infected rams or bucks. And then a really, really important source of infection, particularly to humans, is placenta and amniotic fluids. So at the time of birthing, or abortions, due to this agent, the placenta carries an incredibly high number of this bacteria, as do the secretions, the other birthing secretions. So amniotic fluid that's coming out, and the vaginal secretions that come along, uterine secretions that come along with birth. Hosts for this agent include sheep, goats, and cattle, dogs and cats also. Not to go into many details on this because I could talk a really long time about this agent. I think goats and sheep have been kind of given a bad name, but if you look at for this agent in particular, however, we do know that it's carried by cattle at probably a pretty high rate. There's been several bulk tank tests done that have detected Coxiella in anywhere between 70 and 90% of the bulk tanks that have been sampled have Coxiella in them. So we know that cattle are carriers also. Um, and cats and dogs, but thought to be less so. But they too can carry. And all of these animals, during birth, that's really the most important time for transmission and environmental contamination with this organism. Ticks are reported also to be able to transmit and carry this organism, but they're thought to be a pretty minor player in transmission of this organism. Infection with Coxiella burnetii typically occurs via inhalation. However, oral and venereal routes are also possibilities between hosts. Inhalation is probably the most common for human infections, though. And I think the fear of this agent is that it requires a really low dose or a low number of live bacteria to actually cause infection in humans. And also a little bit more about this zoonotic agent. For humans, it can cause pretty severe disease, but it's at a pretty low percentage of those that are infected. Probably the biggest concern for humans is that it also can cause reproductive problems. So for pregnant women, it can cause miscarriage in pregnant women. Um, and back to sheep and goats, transmission, once an animal, again, goes systemic, bacteria goes systemic, so circulating in the blood, makes its way to the uterus, crosses that placenta. It often results in late-term abortions, stillbirths, and weak neonates. And again, the placenta is really important for diagnosing this agent as well. And this is a reportable disease agent. It's federally reportable no matter what state you live in. And it seems like it varies from state to state, but the majority of states in the United States anyway, it's reportable. And I saw that there was somebody who had signed in from Canada. I'm not sure what the reportability in Canada is, but definitely in the United States, it must be reported to the CDC within a week. And in humans, just a little bit more about the zoonotic potential of this. Often people, I mentioned it a little bit, but the majority of people, roughly 3/4 of the people that become infected with this organism don't even realize that they're sick, or they may feel a little bit off. They may get a fever, may have a cough for a while, or you may never even realize that you contracted it. So, I mean, I'm one of them. People that work around sheep and goats and during birthing time in large numbers probably have antibodies in their blood to this organism and don't even realize that they had been infected. But it's those few cases, particularly in immunocompromised people, and people that have heart disease issues or valve problems, valvular disease. It can cause an endocarditis, and it can be fatal to those few a relatively few number of people that are infected. So the next agent that I'll talk about are Listeria species. So there's two types of Listeria that we think about with sheep and goats. Both can cause abortion. However, the second one that I have listed here is probably a much more common cause of abortion than the Listeria monocytogenes. Listeriosis caused by Listeria monocytogenes is typically associated with the neurologic disease. So if you have wet or silage that isn't put up correctly, or wet feed in a bunk, this the source of the bacteria, it's found in the soil, it's found in the environment, it's pretty ubiquitous actually in the environment. But when it propagates, when there's spoiled hay or silage, or when it's shed in the intestine and feces back into the environment, contaminating an area, and then you have a bunk, say, that has older hay that gets wet, moist grains, things like that, it can propagate in there and then serve as a source of infection. And again, once an animal ingests one of these Listeria species, it can do one of two things. Monocytogenes will go to the brain, and it can cause severe neurologic disease in sheep and goats. And in the case of Ivanovii, more likely it will go to the placenta. It seems to have a pretty high affinity to go to the placenta, where it can cause, typically it's sporadic abortions, right? So that you or doe had to be just in the wrong place at the right time, or the right place at the wrong time, eating from an area that has a bolus of this bacteria that has propagated. And fetuses in this case are become infected by this bacteria, and often when they're born, they're autolyzed or kind of rotten, if you will, so softer, kind of broken down a little bit. It can also cause stillbirth or weak kids to be born, and it kind of depends when that ewe or doe was exposed to this agent. This organism can be shed in milk. And it can be shed by clinically normal carriers or clinically ill does or ewes, but often carriers of this show no consequence, and they will shed without you knowing that they are infected with this agent. Following abortion, you can see metritis. So you want to make sure, if this is diagnosed, that you watch the ewe or the doe to make sure that they're doing well, that they've cleaned normally following abortion or birth. And again, this agent is zoonotic, and maybe people have heard more about this, hopefully, due to it being in the news as a cause of some foodborne illnesses, such as processed meats, ice cream. I've seen outbreaks in the news about it. So, and that's typically Listeria monocytogenes for the foodborne illness. The next bacterium that I'll talk about is Brucella ovis. This agent primarily has reproductive impacts in that it infects rams. So this is a sheep infectious agent. It causes epididymitis, so it causes poor fertility. So you have ewes that just won't take and having rebreed issues. Something to consider would be this agent. It can also cause abortion and perinatal mortality, though. Um, so a venereal transmission, again, when you bring in a new buck, potentially as a carrier, you may expose your flock to this agent where it can lead to abortion and or perinatal mortality within your flock. Ewes, though, seem resistant and they typically will clear the infection, it's thought. So they don't maintain this infection in their uterus once they have initially been infected with this organism. Unlike rams, this bacterium, for whatever reason, seems to like to live in the epididymis, where it can be shed then in semen. And unlike most Brucella species, this is not a zoonotic agent. So one break that sheep get in the zoonotic agent world. Brucellus abortus, on the other hand, is a zoonotic agent. This is a reportable disease agent. Natural infections, though, in sheep and goats, even though it's been reported, it's really rare, even in the literature. And Brucellus abortus is in the United States is is considered exotic to most of the states, right? We have some nitises of Brucella abortus, one being in like the Yellowstone area with bison that folks maybe know about, but uh, but overall, Brucellus abortus, very, very rare reports in sheep and goats as being an agent that causes abortion or disease. So Leptospira species, where are we at here? 439. So there are multiple Leptospira species. All of them can cause abortion. And a source of the bacterium, depending on the serovar, kind of tells you the source. So like Braclavia, the natural host is pigs typically. Grippotyphosa, often raccoons, ictrohemorrhagia. Think about rodents, so mice and rats, canicola, canine. But carrier hosts will shed this in urine, and it can survive for months in contaminated water, feed, soil. Um, and as I mentioned, the source of the bacteria is really dependent on the species, right? So different species have different natural hosts. Infection is often through the oral route again, though, but it can also be transmitted through breaks in the skin or mucous membranes of the eyes or mouth. It causes a bacteremia in the dam. So the ewe or doe can be infected, become bacteremic, which means that that bacteria is moving through the bloodstream, goes through the placenta, and it can cause sporadic abortions kind of at any time during pregnancy, or it can also cause stillbirth, again, depending on the timing of infection. This agent can also be spread, or can also be shed in milk. And it's reported to be a cause of a hemorrhagic mastitis. So not only is it shed, but it can have some detrimental effects on the dam. And this too is a zoonotic agent, so can infect people. There we go. I won't say much about mycoplasma species. Just know that there are several that can cause abortions, and they're typically late gestational fetal death, so late, and then expulsion of a more developed, so later term fetus. Carriers in contaminated environment can be sources of these agents. These agents are also agents that can cause mastitis in the dam. So the difficult part, I don't know if we don't recognize these as often, if we miss them, because many mycoplasma species are really difficult to culture. We call them fastidious organisms. They require very special media, and even given that, they don't always propagate well for us to make a diagnosis. We can use molecular detection, so looking for the DNA of that bacteria. But we don't even have here, we have a mycoplasma species PCR that we could run if we suspected this, but we don't commonly run it for our abortion cases. So, question 2.
Okay, question 2. This is
Oh, I can read it. Each of the following infectious agents are considered zoonotic agents, meaning they can be transmitted to and cause disease in humans, except which of these agents? Yes. I can see the numbers. Looks good.
And I'm going to go ahead and announce our winner for last week's raffle. So the winner of the book this week will be Miss Sherry Nolden. Congratulations, Miss Sherry.
oh, congratulations. And you have also some questions in the chat, Gabriel. to Dr.
There was one more question relating to the iodine with the goiter. If you
Okay.
wanted to go over that, I just thought we would circle back once we had a break. She just asked, did you generally see underdosing or overdosing for iodine?
The most common that I think has happened is from plants, from brassica type
So like an
species of plant.
overdose.
So probably increased, yep, goiterogenic. That kind
Okay.
they interfere though. So it's actually a deficiency really because they interfere with the normal iodine
Interesting.
metabolism.
So they're kind of pretending to be iodine.
Yeah,
And
of
so the
sorts for their
body's deficient in real iodine because it's getting this artificial, what seems like iodine.
yep, that's how I would.
Very cool. Well, thank you for that. I actually have a question about so when you have, say, you've started having a few abortions in your herd and you've decided that you would like to go ahead and test um, one of your fetuses that was aborted, most of your slides seem to say that you should test the placenta. So what, like, say I decided I'm going to test, are you about to talk about that?
Uh-huh.
Okay, sorry. Okay, then I'll let you keep just
After I
keep
go
talking.
through a couple of viruses.
Okay,
I
okay,
am about diagnostics. Yeah, right at the end.
okay. Very cool.
Yeah.
Do you
Yeah.
want to give some feedback about the the responses of the poll?
Oh, sure. So, I just decreased it, but I think most people had the correct answer on that. The majority did. So it's Brucella ovis. That is not a zoonotic agent. All of the others are. The other one that you may identify with being foodborne illness is Campylobacter. That one too is an infectious agent that living in Mayo and things like that are sitting out, deviled eggs sitting in the sun. That's what I think of, I guess, for that one. But yeah, Coxiella, definitely a zoonotic agent of high concern. Toxoplasma can be, and it can be transferred in milk be shed in milk, so unpasteurized milk. And then Brucella ovis, though, is the one Brucella organism, the one Brucella bacteria species that is not zoonotic. So I definitely want to cover Cache Valley because I know this has spread across the United States from where it started in Cache Valley, Utah area, years ago when it was first identified in this country. So transmission is through mosquitoes. They think mosquitoes primary, perhaps biting midges, insects, so biting insects. Often, a ewe or a doe will be infected and have little consequence. You may miss a fever if she did spike one, maybe off a day, but really little consequence to the doe or the ewe. And particularly, I would say ewe. I see this a lot in sheep, including in this area in the Midwest. I'm not sure if you've seen a lot of this in Missouri or other places that for those who are online from other areas. But so again, transplacental transmission causes abortion. Some really important signs that give you a clue that Cache Valley is responsible. Arthrogryposis, which basically means the joints have contracture, poor muscle formation, so it's like a twisted limb syndrome, but it also causes CNS lesions. So you want to open that head and look at the brain. it'll cause hydrocephaly. So sometimes, and I'll show a picture of that shortly. I'll describe that a little bit more. This too is zoonotic, but it's only transmitted by the bite from a mosquito. So people have been reported to have Cache Valley virus, but they get it from the same way a sheep or a goat potentially would get it. Diagnostics, we look at this by trying to find the DNA of this virus in a procedure called PCR, polymerase chain reaction testing. So that's looking for the DNA in the fetal tissue. You can test the serology on the dam or on fetal thoracic fluid. If the infection occurred at a later time in gestation, so that the fetus could have developed an immune response to it. The immune system doesn't really develop until later in gestation. So this is hydrocephaly. So you can see when the brain case was open, and I'll show you the tool that we opened the brain case with shortly. It just collapses. So it means that those ventricles are just expanded, and there's not a lot of enough brain tissue that has developed. So hydrocephaly. This is a picture actually from our UW research program. Todd, thank you to Todd Taylor for sharing this. So you can even see on this baby that dome-shaped head, abnormal, very twisted. Even the spine has a twisted appearance, really little to no muscle mass on this baby. So and infection really depends, or so consequence of the ewe or doe being infected really depends on when it happens in gestation. So if it happens in early gestation, typically you'll have early embryonic loss or mummification of very small fetuses. If it happens kind of more middle, so 32 to 48 days of gestation, that's when you get these twisted lambs with the hydrocephaly. If infection occurs after 48 days of gestation, often the lambs are born normal, completely normal. So there's this window of time when mosquito bite poses a big threat in an area that is endemic for CVV. So maybe a little bit about management. If you have planned breeding where you can keep them away from wet areas or keep mosquito control down during certain areas, during certain times of gestation, may be far more important than in others. So
Okay, question 3.
all of the following are true regarding Cache Valley virus, except it's so remember, people get it the same way sheep get it.
Okay, I will be stop and sharing the results. Everybody.
So B is actually the answer. You can't get this directly from a sheep. So it doesn't transmit from the sheep directly to people. The human cases that have been identified are believed to be mosquito bite cases. So mosquitoes are the primary vector for this virus.
Okay.
Border disease virus, not very common, I don't think. It's very similar to bovine viral diarrhea virus in cattle. And carriers can shed virus in their saliva, feces, urine, placenta, placental fluids. You can get persistent infection in sheep. And again, this is more of a sheep virus. And goats, it's really rare. But those persistent infected animals, similar to BVD, for those who know a bit about BVD, they'll be infected, but they won't have any antibodies but you can detect the virus in their blood by molecular detection. So it means their body thinks that having that virus present is normal. It's a normal part of them, but they are actually a source of infection. So it doesn't have any consequence to them as adults as they carry it and shed it amongst your flock. And those are the animals that typically would be culled. Um, in if a female or a ewe is infected for the first time, exposure and infection when she's pregnant, if that occurs less than gestation day 60, you'll get resorption or mummification of that fetus, or you may have small, weak, and rarely normal animals born. And that's when those PIs, those persistent infections happen. Those rare animals that can make it through that initial early gestation infection to go all the way through to be born, those are the animals that then serve as a source of infection to a flock. If the ewe is pregnant and greater than 85 days of gestation, you will typically, you'll see abortion, or you may see birth of weak animals, or they may be normal and virus negative. So it means they cleared the virus, and they made it through that infection. Um, so grossly identifiable congenital malformations are again that hydrocephalus. So you want to look at the brain. They don't get the twisted limbs from this, so that's one way to differentiate it really from Cache Valley virus. But the classic syndrome that maybe people have heard of is hairy shaker lambs. So lambs will be born with very fine wool and they have tremors because remember, this virus impacts the brain, that hydrocephaly and poor brain formation, which is really the classic presentation. BVD is very similar. It's not as common, but it can be transmitted cattle to sheep and goats. And I'll move on without saying much more about that. Blue tongue virus, an important one in the United States also. Disease in adult sheep, you'll get, as the name, it causes a vasculitis. And the blue tongue, like literally their tongue will look blue because their blood vessels are inflamed. It'll cause hemorrhages, etc. Adult goats, though, goats rarely show symptoms when they're infected with blue tongue virus. Biting midges are the primary transmission source. And for areas that have live vaccines available, iatrogenic, those can also cause abortions and or malformations in the fetus if you vaccinate during pregnancy. Congenital defects, probably the most important thing here. You'll get dummy lambs or again that hydroencephaly, microencephaly, so just poor brain formation. As you see here, was just like a sack of fluid when we opened the top of that brain. This is a picture from Kansas and it just collapsed in on itself. This actually is probably Cache Valley, but represents the same thing for the brain image. So again, just a review. If you see twisted limbs and that CNS and the brain malformation in the United States, think Cache Valley virus. Really, nothing else does that. There's a foreign animal disease that'll do that. I feel bad saying you just know that's it. We might miss Schmallenberg because it's so similar to that, but Schmallenberg is considered a foreign animal disease in the United States. If you just see the brain lesions, think border disease virus or blue tongue virus, as arthrogryposis or twisted limbs, very, very rare with these viral entities. And if you see arthrogryposis, so just twisted limb without brain malformation, there's genetic causes for that, particularly in sheep. And then there are some plants that can cause it. But these, the toxins and the genetic defect does not result in the brain malformation. And I won't talk a lot about this one. I think I'll skip it so we can get to the end here. So I kind of walk through what we do when we get a fetus for doing an abortion workup on sheep and goats. So we check externally, we do a crown rump length. This sample is very important. I kept saying placenta, but it's only because it is the most forgotten tissue ever, or people can't find it. And I always joke, I'm like, if you have to play tug of war with your dog to get a piece of placenta, or go down the ewe's throat and just to grab a piece of placenta, I mentioned placenta so much just because it's often forgotten as being a really important part of the abortion workup. This sample is really important, and this is abomasal fluid, which is really like the amniotic fluid, right? Because they're breathing and swallowing the amniotic fluid in and out. It's probably one of the most sterile sites of trying to get a good clean sample to do testing on. And then we open the lungs, we look at all of the internal organs. We collect fresh visceral samples from lung, liver, kidney, spleen, plus or minus, always heart, too. And then we want brain also. And I said I would tell you how I got the brain case off. It's these bone clippers or rongeur type instruments or thick toenail cutters. Brain is pretty easy to get the cap off if you want to look. You could also use a small saw if you needed to remove that brain, or even cut the brain in half, and you'll still be able to see if those ventricles are way too big and there's not enough brain tissue in there. I talk a little bit about sending in tissues and how to do that in this slide. And then the fresh and fixed that we want. But the best thing, sheep and goat fetuses are small. They're like, 2 to 10 pounds. Put them in a box, bag that placenta up separate, put them on some ice packs, and send them to your diagnostic lab of choice. And just let us do it. We have a cleaner environment. I even tell veterinarians that on something so small, don't try to do a field necropsy. Let us do it under a clean hood, a biosafety cabinet. And then I talk a little bit here, and I'm happy to share this entire presentation with anybody who's interested in getting it. And plus, this is also recorded. So this talks about how we go through diagnosing some of those agents I was talking about. Toxicology testing can be done on liver specimens. So for micronutrient analysis in the fetus. And I think you all know the answer to this. True or false, the placenta is a very important tissue to submit for diagnostic abortion investigations.
Let's see what answer the people.
Because like if somebody doesn't answer that right, they're messing with us.
Yeah, very, very, very fast. Yeah,
Yeah.
yeah,
Yeah.
yeah.
So I will also tell you the other reason placenta and the whole fetus are important. Sometimes you'll get a detection on the placenta from the environment. So remember some of the things that are in feces, we may get a low-level detection in that. We want to make sure that we have the placenta and we look at that under a microscope to make sure the lesions match what the detection is in the fetus and in the placenta. So a full workup, and I'm going to sell diagnostic Wisconsin since I'm from Wisconsin. We actually we do require that a DVM submit. We take in-state and out-of-state, but really any diagnostic lab that you trust, just submit that whole fetus and the placenta. Make sure they have the testing that you need or that you want to rule out. So we have a really nice panel here of most of those infectious agents that I covered are in a PCR panel. So Coxiella burnetii has to be ruled out first. But when we run our PCR, so the molecular to look for the DNA of that infectious agent, on that panel, we're also looking for Campylobacter, chlamydia species, Neospora, Toxo. So we have a pretty good PCR panel, for example, at the diagnostic lab here. Out of state, which and I know other diagnostic labs also offer this all-inclusive for $165 plus a $10 submission fee. But again, you have to have a DVM submit it for you. So we can communicate results and so forth with them through your DVM. But we can do the full gross examination, the histopathology on all of the tissues. We do the cultures that we set up. So we culture placenta, abomasal fluid, lung and liver, and then we run those PCR panels to do like the DNA detection of those organisms. It's a killer deal. If you try to submit just tissue, for some reason, our billing is 166 if you just want to run one panel. But we do all this extra work kind of goofy pricing, I think, on our part. But so that's if you have a bottle necropsy. But if you submit the whole body necropsy, it's 198, but you're still getting, I mean, for $33 more, your DVM's not trying to collect all the right tissues and get the whole workup, right? So a bottle necropsy, I should have explained that. A bottle necropsy refers to if your DVM collects all the tissues for you and submits them, so the fresh and fixed tissues. And then if you submit the whole body, these are our charges for in-state and out-of-state. And with that, I should thank the residents that helped create those pictures to go through how to do a necropsy on a fetus. So it's Dr. Alex Ford and Dr. Gianelli Rodriguez Ruiz, who were residents at Kansas when I was a pathologist there. And that's my old goat. Well, he passed away, but he was like 22 years old.
Wow.
From a middle ear abscess that went into his brain that I didn't know he had. Or he probably would have lived to 50. You know, he was a tough old goat.
Wow.
And that was a lot of information. I'm always open to whether you submit samples or a client here, I never mind questions or communications with what I can provide, even for producers. I consult with a lot of sheep and goat folks. So
Yeah. Yeah, there is a lot of information. The people is so happy. In the last year, we start having less attendees to our webinars and field days, and I start asking why. And because they start answering because we're receiving the same information every place. So they are so light information. I say, okay, you want deeper information? Okay, we are going to get it. So no complaints about
overload.
that deep information we are getting. So this is the key person. Thank you so much, Dr. Highland.
Thank
Yeah,
you all
thank you
for
for being here.
attending. I know that's a lot of information.
Yeah, but over there is your contact information so that people can contact you. And for sure, we are going to keep in contact with you.
Somebody had asked, kind of scary too. Somebody asked if the presentation can be mailed to an individual. If I provide it, could somebody contact you if I just provide you a PDF form of this
Yeah,
presentation?
yeah, I can share you want even for the people that came here, or they can send me
Okay.
an email so
Yeah.
to keep track of who wanted, and I can share later on who were asking for your presentation. Yeah,
Oh, thank you, Brookshire. That's really nice. Thank you for the nice comments. That's very nice.
yeah. And
I'm so sorry. I was trying to keep track of the chat and it was frozen at the top and I did not see a bunch of those questions.
Ooh, gastrochesis. No, I don't. Genetics, I would say. Melissa, so you literally have like ventral gastrochesis. I don't know that I've ever seen that. I would be concerned, 22, I would be concerned about a congenital problem. Like a genetic, I mean, not congenital, sorry. What is a bottle necropsy? Oh, what is so hopefully I described that, Tanya. I realize that I went through that kind of quick. So a bottle necropsy is that if you or your veterinarian do the dissection that I outline in those images and you get tissues put in formalin and some saved fresh for us and then send that in. So we're not doing the full gross examination and collection here. So it's a little bit, saves you a little bit. Do you think we see an increase in AGROP? I'm not familiar what AGROP is, Leslie. Should I know? So the question was, do you think we'll see an increase in AGROP? I'm not sure what that is. I don't know if Leslie's still on. Um, did I miss any other questions for anybody that's still on? With lactones. Uh, oh, um, not to be weird, but I picked B and picked A. I'm not sure what question that was for cull lamb kid that survives.
There was a question, can unpasteurized milk be tested for Neospore, Canyon, or Toxoplasma?
There was a question, what was it again?
That unpasteurized milk be tested for Neospore, Canyon, or Toxoplasma?
It can, both of those are PCR detections. So it would look for the DNA of those protozoan agents. Let me go back through and show you. So see this list, this molecular,
Mhm.
our panel, except for Cache Valley, we do not, WVDL does not. I know Kansas does, and there's other places that do, but Kansas State has a Cache Valley virus, border disease virus. PCR, we don't have that here. But these more common infections agents above, our panel has all of these agents on it. So you can test milk by PCR to see if the tachyzoites are shedding.
And there is another question. Are Toxoplasma, protozoa, and milk visible under a normal microscope? Slide?
No.
No.
And actually, you can see them in tissue, toxo. I've seen a cat that has actually died from toxoplasma, and you can see it like in the endothelium or near their blood vessels, but they're very tiny. I'd have to look up, but I want to say they are like the tachyzoite form, like that form that's moving throughout, and the zoites are like 20 microns. So they're so you can see them, but they will blend into other tissue. Like that would be probably a big one. They're more like 10. So a little bit longer, but narrower than a red blood cell.
There is
Would the
a,
lamb be born alive with Cache Valley or with some abnormality?
Yes, there are. So if you survive infection, let me show you this again. So it depends on when they are infected. And if they are born normal because they were infected after gestation day 48, they probably have immunity. They're probably going to be, that's the thought, right? That it's naive animals that are getting bit for the first time that don't have any titers. And I don't know that enough work has been, I wouldn't guarantee that, but I doubt the same ewe would be hit with Cache Valley twice, 1 year and then the following year. So if they're fortunate enough to survive and just clear the virus, they're good. It's just when they're infected before like that month and a half or so. So, I mean, that's where I was talking a little bit about maybe husbandry. Maybe if you can, I hate not having people, if you can have a drier area of pasture or an area that is less likely to have high mosquitoes. I think we had a lot here in Wisconsin because it was really wet here. We've even seen like trematode, which massive infection in a sheep that we received, which because it's been wet in areas that it's typically not very wet. So trematodes, the flukes, liver flukes.
yeah,
So I think that's why there's an increase when you have, get rid of standing water. Don't let standing water like in buckets and things like that, or, tires. That's a good place for anywhere that's a good place for mosquitoes to breed.
yeah. There is another question. Will the milk be sent to your lab for testing?
I think, what's that? I'm sorry.
The milk, would you test the milk?
For Cache Valley?
Um,
or or any disease?
do you
Uh,
test milk?
I test Coxiella for sure. That
Okay.
one's a scary one if somebody is a susceptible host. I say that it's not scary, and then I say that it is scary in the same sense, but it depends on the host that contracts it. I would definitely for milk before, and I don't know what raw milk sales and regulations are. I know some places you have to, you're or supposed to do legal raw milk sales, especially Coxiella. But a lot of these, anything that can be tested by PCR that I had listed as shed in milk, you could try to detect by PCR in the milk.
And then someone was asking specifically about chlamydia and Campylobacter. From a vaccination standpoint, if you have a buck or ram with it, or a ewe or doe, and you give the vaccination for it, does the vaccination cure it and protect them, or is it just to protect animals who don't have it?
That's a great question. So, like there are many vaccines. So there's two type of vaccines, right? You give it to somebody that has never had or doesn't have the agent, or a sheep or a goat, and it's an absolute protection, which means an animal won't get infected. Or there are the vaccines that you give that help prepare the immune system for infection. I believe both the chlamydia and Campylobacter are that. I do not believe they will clear. Most vaccines won't clear. It's to protect before infection, but I don't think either of those really are absolute vaccines to protect against picking the organism up. So, and with particularly Campylobacter, it lives in the GI tract. And that's often, I mean, it lives in a GI tract of a healthy individual too, potentially. But I think it helps protect against disease, right? It kind of keeps it in check, if I had a way to describe it. It keeps that bacteria, those two bacteria in check so they don't cause disease, so they don't go systemically ill, so it doesn't get to the placenta to get to that fetus.
Okay, well, I think we are over time. There is a lot of questions. Yeah. Are frozen embryo or semen straws tested for these common infections crossing the United States border? How do we protect our herds when buying from breeders or warehouses?
So I know for export, we don't do a lot of the export testing for sheep and goat or really any of it here. But for cattle, I know there's a pretty thorough screening. There are agents that we have to test by PCR to make sure that they're clear. Coxiella, I believe, maybe one of them. BVD. I'm not a cow person to know what's on her. Probably should know. Um, but yeah, we test, and it depends, I think, on country that they're being shipped to.
Yeah,
Um, thank you.
yeah.
BVL, that is the other one. And Yonis, yes. Thank you.
Okay, well, Dr. Highland, thank you so much for your time, for your knowledge, and also for the passion that you share everything. Thank you so much. For sure, we are going to have you again some other day.
All right. Thank you. I appreciate it.
Thanks.
I'll
Thank you
sh-
so
I'll
much.
I'll share a PDF right now before I leave so I don't forget of the presentation.
Yeah, sure.
I'll send to the email. Okay.
Okay, thank you.
Thank you.
So, by the way, the winner of the book was Miss. Sorry, I have it right here. Uh, I want to say it was a Connie.
You said already, Rowena.
Uh, Sherry. Sorry, Miss Sherry Nolden.
Yeah. And our next Monday, we are going to have a value add on milk. So don't miss it for next week. So thank you, everybody. Thank you, Dr. Highland, for your great presentation, and have a good week. Very great week. See you next week. Bye.
Bye-bye.
Bye.